Hey guys, just a quick video today about retained primitive reflexes and what it means if your child has one. We'll go through how we can assess for them, what we can do to help, and how to get in contact with us. Hey guys, my name's Abe and I'm the Occupational Therapist here at Brain and Body Health. One of the things I specialise in as an OT is the treatment of kids with neurodevelopmental delay, with the aim being to help them reach their full potential. So when a baby's born, they're born with a set of primitive reflexes which help the baby survive that first couple of years of life. A good example of one is the Suckling Reflex. So when you brush a baby on the side of their cheek, they turn to that side, and what that does is it helps the baby find the nipple so they can feed properly. Now, as we get older and our brains get more complicated, these reflexes should start to switch off. Now, if they don't switch off, it makes it very difficult for the brain to do more complex tasks related to behaviour, emotions and academics, and it also makes it very difficult for the body to coordinate different movements. So what we're testing for here is called the Moro Reflex. The Moro Reflex should be switched off by 5 months. Kids who haven't switched off the Moro Reflex are very fidgety, very anxious, and find it hard to sit still and concentrate. We can see in the patient here that her arms slightly move, which means that a little bit of this reflex is still affecting her development. In this video we're testing for what's called the ATNR. This reflex should be switched off by 4 to 6 months. Kids who haven't properly switched off this reflex often struggle to use both the left and right side of their body together, which means they struggle with hand-eye coordination, balance and athletic performance. You can see in the patient as we turn her head that the hips slightly move to one side, just indicating that this reflex hasn't switched off. Here we're testing the STNR reflex. It should be switched off by 12 months, similar to the previous ATNR reflex. It helps to coordinate the upper and lower limbs. Watch the spine collapse as we move the head. So that's how we test for some of these retained primitive reflexes. Now, it's very important that we give our kids a solid foundation for further learning by having these reflexes switched off. If your child does have some of these reflexes, switching them off can make life easier by improving behaviour, academics, emotion and coordination. If you think your child is being held back by some of these reflexes, give us a call on 9817 6611 or click on the link.